Hello, I'm Dr. Deborah Manjoney of Wisconsin Vein Center and MediSpa. We often see people who are concerned about scars they have and wonder if there's anything they can do to make the scar look a little bit less dramatic or less apparent than it is. And it really depends on where the scar is, how bad a scar it is, but there are often many things that we can do that are minimally invasive or non-invasive to improve the appearance of the scar. The earlier we can treat a scar, of course, the better, because we can start you with a silicone pad or some external scar treatment that you can brush on that's going to reduce the risk of getting a raised, elevated scar. And it will also just help blend with the skin a little bit better. However, we can also treat scars that are years old. So if you have a scar that's of concern, often when we evaluate it, we can determine whether or not we think a laser treatment will help. By doing different lasers, and especially using fractionated lasers, we're stimulating normal collagen. A scar is abnormal collagen that forms, and with the lasers we can actually make the collagen form as a normal structural collagen to even that scar out. And so often what we can do is fractionated laser. One treatment may be enough, or a couple of treatments a month apart, and you can see a real big flattening of the scar and an improvement of how the scar looks. In addition, a scar that's discolored or a red stretch mark, something like that, can also be treated with intense pulse light, and we can reduce that coloration. So yes, there are things that we can do for your scars. The earlier we start, the better, but don't think that a scar that you've had for years can't also be made improved, because we can do that also with other techniques that we have. Everything done in a minimally invasive fashion.